The key thing here at the hospital is the investigation into what went wrong. Essentially that this health worker was able to be infected by Mr. Duncan while attending to him, which she did quite regularly. Now, she was questioned, her fever was very low, the virus was caught in its very early stages, so she was able to talk to the investigators and said that she didn't realize when that moment might have been. There was no risky period when she could have become infected. So of course all eyes are on those other people who've been involved, who have been dealing with Mr. Duncan before he died last Wednesday. They, of course, are monitoring themselves to see if they have a fever. Obviously, there was always a sense that there was a risk that someone else would be infected with Ebola when Mr. Duncan arrived here and developed the symptoms. But it was more thought that there were 48 people who had close contact with him in the 4 days when he was contagious, before he was admitted to the isolation ward here. He actually came to a doctor with a fever and was sent home. There were mistakes made in the process that led to him being looked after here. And it was thought that those people who again are being monitored for 21 days to see if they will actually get a fever and develop the virus, that perhaps they were most at risk. But now all focus is on trying to make sure that those protocols aren't breached again, that everything here is done effectively with this health worker who's been infected, to ensure that no one else, here in Dallas at least, contracts the Ebola virus.